Gut-wrenching, appalling, horrific, disturbing. Those are only a few of the many words being used by Canadians to describe the horrific situation that was come upon at several long care facilities in that country. It was over the weekend that the Canadian Armed Forces released a report that showed the conditions under which, or the terrible conditions under which, many of the country's senior citizens were living. Bug infestation, lack of attention, force feeding are among the many things highlighted in the report. Also, over the last 2 months, it was revealed that over 70% of the coronavirus deaths in that country were also happening inside the long care facilities. So many investigations are now going to be led as a result of that report, which was brought forth and read in detail today by the country's Prime Minister, Justin Trudeau. Hi, welcome to Depth, not just headlines, on Depth TV. I'm Deborah Anderson, bringing you in-depth details on the situation with the long care facilities in Canada.
Help the most vulnerable Canadians as we deal with this pandemic. And as the need for their help continues, we've received new requests to extend this period of deployment in both Ontario and Quebec, and we will be following up. Members of the Canadian Armed Forces are doing an incredible job, just like always. They are serving with distinction for our grandparents, our parents, our elders. In Ontario, they've made some extremely troubling observations about several long-term care facilities in which they've been serving, and we have shared this information with the provincial government. As I've said many times, we need to do a better job of caring for the people who built this country. The greatest generation saw us through World War II, and we need to be there to support them properly through this global crisis. I spoke with Premier Ford on this earlier this morning to let him know that, of course, we would be there to help as he takes action on improving care for seniors in long-term care centres. Our government will continue to support Ontarians through this, and I know this is something the Premier will be addressing in greater detail at his press conference later today. This morning, I also wanted to provide an update on personal protective equipment. In the last 10 weeks alone, Now, the country's Premier, Doug Ford, says a full investigation has been launched into the report's findings to be headed by an independent commission. He adds that the possibility of incorporating the homes as part of the public health system will also be explored. Premier Ford used descriptions such as disgusting and horrific to describe the findings, which revealed healthcare professionals grossly neglecting patients and leaving them in filth. The Canadian soldiers had gone in 2 months ago to assist at the homes, where they came upon cockroaches, stacks of unclean utensils, and significant gross fecal contamination.
IMS table that is reviewing all those aspects. We have given some documents that would look at some increased visitors. I think what the important part to remember in the issues that were raised today is that, as you know, you have the military in 5 of those homes, and you have many of the hospitals in a number of other ones that the IMS table had considered of concern. The point being is that we don't want anyone left uncared for during this time of the outbreak and dealing with this the impact of that at this time. So I think that was one of the steps by bringing in the Canadian Armed Forces, because the Premier and others did not want to see areas where, because of staff shortage due to quarantine, that long-term care residents were left uncared for. And so there's some more steps to do that. And you can see from some of the discussions today that the Armed Forces have come in and done an excellent job at the 5 homes that they're involved with to make sure that did not occur, or was not occurring. And of course, I know that a number of the hospitals have stepped up and are doing their part as well in that. On your point, yes, we continue to look at when we can get the green light, if you may, to start allowing more family members in, because it is impactful and we want to understand that. And having had family members in long-term care myself, they really do depend on those type of connections. And so it was something much like the Premier would like to see if we could get that up and running, but not such that it puts them back at risk again, because as some of the numbers, we still have community spread to some extent, and we do not want to reintroduce it back in, either through visitors and or staff again. So we want to be cautious and yet caring and compassionate at the same time.
Follow up?
And do you have any concerns that loved ones are going to?
News will continue to keep you abreast of this situation. Don't forget to like, subscribe, and share. I'm Deborah Anderson with Depth, not just headlines. Thanks for watching.